In terms of my work, so what's my piece of this? So again, I was part of this steering committee. The one sort of sub-analysis that we did of this study was, I'm very interested in clinical genetics in the cancer population, and really one of the goals of my research is how do we make clinical genetics and genetic testing more available to cancer patients, and how do we sort of break down some of the barriers to identifying genetic risk in patients. So a study that Talia Galan, the senior author, and I did last year was we looked at people who were found to be BRCA positive through the screening part of the study, and we looked at how many of those people knew they were BRCA positive before they came into the study versus were newly found families. And what we found was a pretty striking racial disparity in that group. Particularly, the punchline was that African American and non-white patients on the study were much less likely to be aware before they were tested as part of the study that they carried one of these mutations. And so I think that says a lot about who has access to testing in society, who's aware of these mutations, that we have great medical guidelines about how to screen people and how to potentially prevent cancer. And so when you see strong racial disparities, it tells you that some of these fancier technologies like genetic testing aren't equally available to people, or there are barriers that people aren't getting them that we need to try to break down. So that was sort of one sub-study we've done of this data. Some of my work personally also looks again at a part of this issue, which is how do we know there's barriers, particularly racial ethnic barriers, to understanding genetics and to seeking genetic testing and using that information to make your health better. So we have a large grant from the American Cancer Society that looks at developing an education tool both for patients and for doctors to help patients and doctors better understand some of the barriers to sort of genetics and genetics as it relates to cancer care, and to help explain to them and make them understand that really genetics is no different than getting your blood counts done and making sure your kidney function and liver function are okay. It's all part of your doctor having a better idea of how to treat you in an appropriate way, and like the olaparib study, like the POLO study, potentially giving you a therapy that can give you, again, a reprieve from some pretty toxic stuff. And if these numbers continue like they are, to be able to offer someone 2 years away from multi-agent chemotherapy with a single oral agent, I mean, I can't imagine there would be anyone out there who wouldn't jump at that. So I think that's again another focus of some of the work that I'm doing. I have a co-investigator from Temple University named Sarah Bass, who's a behavioral scientist. So we're about a year into that grant, and have had some great success so far on that.